Hello friends, I am Dr. Chanchaldeep Kaur with another interesting and learning episode of B.Pharmacy on the important unit of drug distribution systems in hospitals, which is very important unit of the section of clinical and hospital pharmacy of B.Pharmacy 8th semester. Let's start our episode while taking a look at what we are going to learn today. Module 1 is Introduction to Drug Distribution System in Hospitals. Module 2 Types of Drug Distribution Systems in Hospitals. Module 3 is Outpatient Dispensing in Hospitals. Module 4 constitutes Inpatient Dispensing in Hospitals. Module 5 Conclusion. So we will be starting with Module 1, that is Introduction to Drug Distribution System in Hospitals. Let's start with general introduction about various drug distribution systems in the hospital. We know that hospital is an organization of healthcare facilities arranged to maintain or restore the health. It has two categories of patients, that is inpatients and outpatients. Accordingly, drug distribution services are there in hospital. Inpatients are the one who occupy the bed in the hospitals, that is they are admitted in the hospitals, so they need 24 hours of services, while the patients not occupying the beds are outpatients and they are also known as ambulatory patients and they need short-term services. In the hospital, there is a hospital pharmacy which is responsible for the procurement, storage and distribution of drug in the hospital. It is their duty to provide a complete drug distribution system for the efficient delivery of drugs to the patients. The drug distribution system falls under following important categories. First is the ward control system, which is also known as ward basket system. In this system, ward seeks medicines of 2 to 3 days from hospital pharmacy and then administer to the patients. This system is nowadays not used in public hospitals. Second is the pharmacy controlled ward based impress system. In this system, a range of drugs commonly used are available in each ward and there is pharmacy staff to manage it. Third is the pharmacy controlled ward based patient issue system, which is also known as direct patient issue system. It is type of unit dose dispensing as the drug is directly issued to the patients. Now module 2 is the types of drug distribution systems in the hospitals. The various drug distribution systems in hospital are as follows. Here we are giving the summary of various types of drug distribution systems. First is the inpatient drug distribution system and second is the outpatient drug distribution system. The following chart shows us various types of drug distribution systems in the hospitals. So drug distribution systems in hospitals, as we have seen, are of two types: inpatient dispensing and outpatient dispensing. In inpatient dispensing, there are 4 types. First is individual prescription order system. Second is complete floor stock system. Third is combination of both these systems. And fourth is unit dose dispensing system, which is of 2 types. One is centralized and second is decentralized. Similarly, outpatient dispensing system, it constitutes of 4 types: emergency patients, tertiary care, primary care and ambulatory. Dear students, till now we have seen that there are various types of drug distribution systems in hospitals. Now we will discuss one by one these systems. First we will study about outpatient dispensing in hospitals. Module 3 is outpatient dispensing in hospitals. Outpatients are those who do not occupy beds in hospital. They are also referred to as ambulatory patients. Outpatients mostly need primary care. Outpatient dispensing is one of the basic function of the pharmacy department in any hospital. Outpatient services division does following works. First is the compounding and dispensing outpatient prescriptions. Second, inspect and control all clinic and emergency service medication stations. Third, they maintain prescription records. Fourth, provide drug consultation services to staff and medical students. Various types of outpatient dispensing include: first is the emergency outpatient. As the name says, emergency. In accidental conditions or emergency, immediate care is given. But if they are not admitted in hospital, they will be called as emergency outpatients. Second or B part is tertiary care or referred outpatient. If any other physician or doctor refers to a specialist of a hospital and the care is given by the physician of the hospital, then it will be called as referred. Third is the primary care. The general care given to regular patients coming to hospital includes primary care. It includes prevention, health maintenance, treatment, etc. This is the basic facility or basic one. D part is ambulatory patient. It is a special term generally used for outpatients. As they come, take care and walk away. So the term ambulatory was used. Now we will discuss location and layout for outpatient dispensing. The location of outpatient pharmacy should be separate and located in the minimum disturbance area. It is preferred to be located in the ground floor of the building and should be nearer to the entrance so that patients could easily locate it. The layout of outpatient dispensing area carries good or a bad impression about the hospital depending on the services they get. Unit must have prescription receiving window and delivery window. The waiting area should be provided. This area should be elegant, clean, ventilated and provided with comfortable seats because here patients have to wait, so it should be elegant. The newspapers, magazines, etc. related to the medicine and pharmacy can be provided in the waiting area. There should be informative posters attached and should be spacious to avoid discomfort due to overcrowd. Then comes receipt and issue system for outpatients. As per requirement of the hospitals, that is, it is a big hospital or small hospital, the purchasing of the drugs are done according to the hospital's purchase procedure. After receiving them from suppliers, the drugs are entered in the receipt register and then stored in the hospital pharmacy according to their storage conditions. Then the medicaments are issued to the patients after receiving the prescription written by the physicians. It's the duty of pharmacist to maintain the record and should be well acquainted with the stock present so that if any drug is deficient, it could be purchased immediately. The activity chart for outpatient dispensing is given below. The figure 2 describes receipt and issue of drugs for outpatient or ambulatory patients. First of all, when any patient comes, then they are to be registered. So first is registration of the patient. Then referring of patient to specific department as per symptoms. Third, prescribing of prescription by the physician, including the name, age, registration number and diagnosis of patient. Then the receiving of prescription by the hospital pharmacist. Then hospital pharmacist, he does the filling, labeling and dispensing of the prescription to the patient. And after giving the medicines, the payment is received, that is receipt of payment. Then the file preparations of the prescriptions and files are prepared, separate two files. One is for regular prescriptions and second is for narcotic preparations. Those are narcotic files. After that, the statistics and report is prepared. Now we will move towards inpatient dispensing services in the hospitals. This is very important because the main part is the patients who are admitted in the hospital. So module 4 is inpatient dispensing in hospitals. Inpatient services division does following works. First is they provide medications for all inpatients of the hospital on a 24-hour per day basis. Second is inspection and control of drugs on all the treatment areas. Third, cooperate with medical drug research. There are 4 systems in general that are used for dispensing drugs for inpatients. They may be classified as follows. First is individual prescription order system. Second, complete floor stock system. Third, combination of first and second systems. Fourth is the unit dose method. So now we will discuss one by one all these 4 methods. First method is individual prescription order system. This system is generally used by the small and or private hospitals because of the reduced manpower requirement and the desirability for individualized services. The important advantages of this system are as follows. First is all medication orders are directly reviewed by the pharmacist. Second, it provides for the interaction of pharmacist, doctor, nurse and patient. Third, provides closer control of inventory. Now we will discuss the main disadvantages of this system. They are: first, there is delay in obtaining the required medication as it goes through various steps. Second, increase in cost to the patient. Now we will discuss the second system, that is the complete floor stock system. Under this system, both charge and non-charge patient medications are carried by the nursing station pharmacy. The regular medicines are stored and expensive drugs are dispensed upon the receipt of a prescription or medication order for the individual patients. So the regular drugs are known as non-charge drugs and the one that has to be paid will be called as charged ones. This system is used most often in governmental and other hospitals in which charges are not made to the patient. It does have applicability to the general hospitals also. Now we will see the important advantages of complete floor stock system. First, ready availability of the required drugs. Second, reduced rate of drug returns. Third, reduction in the number of drug order transcriptions for the pharmacy. Fourth, reduction in the number of pharmacy personnel required. Now we will see the disadvantages of this system. First is medication errors may increase because the review of the medication orders is eliminated. Second, increased drug inventory on the pavilions. Third, greater opportunity for pilferage. Pilferage means the spitting of the drugs. Fourth, increased hazards associated with drug deterioration. Fifth is lack of proper storage facilities on the ward may require capital outlay to provide them. Sixth is greater inroads are made upon the nurse's time. It is the fact that in some hospitals the complete floor stock system is successfully operated as a decentralized pharmacy under the direct supervision of a pharmacist. In the past, the floor stock containers were pre-labeled multiple dose units. But nowadays the floor stock is in unit of use packaging, thereby assuring better packaging control and identity of the medication. The Pharmacy and Therapeutics Committee of the hospital prepares a list of charged drugs as per hospital standards. Then those drugs have to be made available by hospital pharmacist. Now we will see dispensing of drugs to charged floor stock drugs. Charged floor stock drugs may be defined as those medications that are stocked on the nursing station which are charged to the patients, means they have to pay extra for those drugs. Floor stock list is prepared which is sent to make the drugs available to all the nursing station. Under this, pre-labeled envelopes are filled with predetermined quantity of specific drugs and are placed at the disposal of the nursing unit. After the drug is administered, the name of patient and the room number is entered on the envelope and sent to pharmacy for record maintenance. Now we will see dispensing of drugs to non-charged floor stock drugs. These drugs are commonly used and they are stored at the nursing station for the use of all patients on the floor. Generally, it includes less costly drugs which are frequently utilized in the hospital. So, no separate charge is taken. Those charges are already included in the hospital ones. The two methods are used for dispensing of non-charged floor stock drugs. First is drug basket method and second is mobile dispensary unit. Now one by one we will see both these methods. First method is drug basket method. The nurse fills a requisition form for delivery of drugs at their floor. When there is an empty container, the nurse places it in the drug basket. Once the basket is completed, it is delivered to the floor via messenger service. Second is mobile dispensary. It is specially constructed stainless steel truck 60 inches high, 48 inches wide and 25 inches deep. It is mounted on bottom tires. Third is the combination of individual prescription order system and complete floor stock system. That is combination of both the above systems. Falling into this category are those hospitals which use the individual prescription or medication order system as their primary means of dispensing, but also they utilize a limited floor stock. This combination system is probably the most commonly used in the hospitals today and is modified to include the use of unit dose medications. This system is followed in no profit and no loss hospitals like government or private hospitals. Individual prescription or medication system is adopted as a major means. Requirement of drugs or surgical items are given to the patient who purchase and deposit these items in hospital wards or rooms under the supervision of registered nurse. Further, dear students, we will study last important method of inpatient drug dispensing, unit dose system. Unit dose medications have been defined as those medications which are ordered, packaged, handled, administered and charged in multiples of single dose units containing a predetermined amount of drugs or supply sufficient for one regular dose application or use. A single unit package is one which contains one complete pharmaceutical dosage forms like one tablet, capsule or 10 ml liquid. A unit dose or unit of use drug distribution system is in place for all dosage forms to provide patient-specific, individually packaged medications which minimizes nurse caregiver Drug product manipulation, example cutting in half, in order to arrive at the correct dose prior to administration. Such manipulation could result in patient harm and consume valuable caregiver resources. These unit doses of medications are also dispensed with individually labeled barcode packaging to enable nurse scanning of the medication at the bedside just prior to medication administration. The important advantages of unit dose system are: patients receive improved pharmaceutical services 24 hours a day. Patients are charged for only those doses which are administered to them. Medication errors are reduced as the pharmacist himself checks the physician's prescription. All doses of medication required at the nursing station are prepared by the pharmacy, thus allowing the nurse more time for direct patient care. Excessive duplication of orders and paperwork at the nursing station and pharmacy are eliminated. It eliminates the credits and have better financial control. Transfers intravenous preparation and drug reconstitution procedures to the pharmacy. It promotes more efficient utilization of professional and non-professional personnel. It eliminates the pilferage and drug wastage, reduces revenue losses, conserves space in nursing units by eliminating bulky floor stock. It extends pharmacy coverage and control throughout the hospital from the time the physician writes the order to the time the patient receives the unit dose. Communication of medication orders and delivery systems are improved. The pharmacists can get out of the pharmacy and onto the wards where they can perform their intended function as drug consultants and help provide the team effort that is needed for better patient care. The unit dose dispensing procedure. The unit dose dispensing is done by following two methods. First is centralized unit dose drug dispensing system, and second is decentralized unit dose distributing system. Now we will discuss these both methods one by one. First, centralized unit dose drug distributing system, which is also called CUDD. The characteristic features of centralized unit dose dispensing are that all inpatient drugs are dispensed in unit doses and all the drugs are stored in a central area pharmacy and dispensed at the time the dose is required to be given to the patient. To operate the system effectively, electronic data processing equipment is not required. However, delivery systems such as medication cards and dumb waiters are needed to get the unit doses to the patients. Also, suction tube system, which are also called pneumatic tubes or other means, are required to send a copy of the physician's original medication order to the pharmacy for direct interpretation and filling. Now we will see the decentralized unit dose system. As the name says, this system operates through small satellite pharmacies located on each floor of the hospital. The main pharmacy in this system is used as the procurement, storage, manufacturing and packaging system or center serving all the satellites. The delivery system is accomplished by the use of medication cards. This type of system can be used for a hospital with separate buildings or old delivery systems. Although each hospital introduces variations, the following is a step-by-step outline of the procedure entailed in a decentralized unit dose system. Initially, upon admission to the hospital, the patient is entered into the system. Diagnosis, allergies and other pertinent data are entered onto the patient profile card. Direct copies of medication orders are sent to the pharmacist. The medications ordered are entered onto the patient profile card. The pharmacist checks the medication order for allergies, drug interactions, drug laboratory test effects, and rationale of therapy. The dosage schedule is coordinated with the nursing station. Pharmacy technician picks medication orders, placing drugs in bins of a transfer cart as per dosage schedule. Medication cart is filled for particular dosage schedule delivery. Pharmacist checks the cart prior to release. The nurse administers the medication and makes appropriate entry on her medication record. Upon returns to the pharmacy, the cart is rechecked. Throughout the entire sequence, the pharmacist is available for consultation by the doctors and nurses. In addition, he is maintaining surveillance for discontinuing orders. The advantages are easy for the administration staff, accounting becomes easier in certain cases, better stability of the products. The main disadvantages are high cost, consumes more time and doubtful, will occupy more space for storing, ledger posting and inventory control problem. With all these information, here we come to end of today's lecture. Hope we have understood various drug distribution systems in hospitals. Further, have a look again on the complete topic yourself so that you are thorough with it. The topic that we have discussed today is very simple and good. Be well remembered by correlating with the nearby hospitals that we see regularly in our routine life. So dear students, this is Dr. Chanchal taking leave from you with the hope that you enjoyed and understood today's lecture. We will continue in our next lecture with the topic Central Sterile Supply Unit and their management. If you want to learn more and enhance your knowledge, you may log on to our website for MCQ quizzes, LORs, www.cec.nic.in. Till then, keep studying. Goodbye.